There are more than 5 million nurses in this country, and a recent survey found that nearly a third are seriously thinking of quitting, which would be a devastating blow for patients and hospitals. Tonight, William Brangham starts the series about efforts to turn the tide, called Critical Care: The Future of Nursing. It's a collaboration with the Global Health Reporting Center, including support from the Pulitzer Center.
Would you like a coffee, Alfredo?
Ashley Arbilo is fueling up before the start of her shift at Houston Methodist Hospital. She's one of more than 8,000 nurses in this hospital network. But as busy as it is now, she says it's nothing like it was during the height of the pandemic.
People were getting burnt out. Nurses were falling from COVID after treating patients with COVID. I saw staff being burdened from kind of the workload, and the assignments were just insane with how many patients were coming in.
Did that change your mind about wanting to stay in this field?
It did.
Caroline Mascarenas, a former nurse here, was a hospital VP when the pandemic threw her into crisis mode.
It was a very trying time. It took an emotional toll, it took a spiritual toll, and it took a physical toll as well.
But even as the need grew, the supply of willing workers shrank.
A lot of my friends left for travel assignments.
Because the pay was so much better?
Yeah, during the pandemic.
2 years in, nurses were quitting at more than 7 times the rate they were before COVID-19. Across the U.S., more than 100,000 nurses quit the profession during the pandemic. Many others left for new jobs, which put hospitals in a tough position. Pregnant and overworked, Ashley Arbilo was on the verge of doing the same.
And I was thinking about leaving. I had talked to one of my former managers and directors, and they were like, please don't leave the system. We may have something for you. Very good. You'll see me pop up on your television.
And this is where she landed, Houston Methodist's new virtual nursing unit, where Arbilo offers up direct patient care from afar to patients in 8 different hospitals.
Good morning. Can you hear and see me?
She takes medical histories, asks and answers questions, and helps with intake and discharge, all remotely.
Very good. So in just a second, I'll populate that paperwork here on my screen so you can follow along with me. And if you have any questions or concerns, just let me know, okay? And sometimes they do ask, like, are you really a nurse? And I'm like, yep, I have my badge on. I'm really a nurse.
What you meaning they wondering whether you're a real human being or whether you're actually a nurse?
Yes. I've gotten questions like, are you real? I'm like, yes, I'm real. I'm real. I'm not AI generated.
Got a pulse.
I do have a pulse. I have a badge on. I'm a registered nurse with tons of experience. I'm here to help you and answer any questions.
It's really the engine room or the control room that represents our whole virtual health system.
Dr. Sarah Pletcher oversees this daily operation.
So you see staff here that are doing more than monitoring. They're also providing direct, engaged care.
Philosophically, is this about improving patient care? Is this about handling lesser staff?
I mean, the rationale is we want to provide better care and do it sustainably. And wherever possible, we can give time back to the bedside team so they have more time to look after the patients that need them on a shift. Looks like you've got a patient on Main 8 ready for discharge.
According to the hospital's analysis, each time Arbilo walks a patient through intake or discharge, it gives 25 to 30 minutes of time back to the bedside nurse. So the idea was that these are the things that the bedside nurses would most like to not have to do and felt like they were interrupting their direct care of a patient. So let's do those virtually.
That's right.
The launch of a virtual nurse corps was just one part of Houston Methodist's plan to hold on to and to rebuild its staff. The hospital stopped hiring temporary or travel nurses. At one point, there had been more than 200 working here. For nurses who remained, they offered flexible schedules, more choice of assignments, and higher pay.
I would say the second quarter of last year is when we started seeing the reverting back to normalization, and this past year we really normalized.
Today, staff turnover is right back to where it was before the pandemic. But that experience is not universal. The state of Texas projects that over the next decade, it will take an additional 57,000 registered nurses to meet patient needs. And while Texas is in a worse position than most, this is a nationwide shortage with a projected shortfall of nearly 500,000 nurses in the next 2 years.
We've been in crisis mode for years.
The woman whose face is on that bus, Diane Santamaria, has been dean of the Cizik School of Nursing at UT Health in Houston since 2018.
Even before the pandemic hit, the average age of a nurse was about 55. So they were already sort of hitting that range where we were going to see multiple people retiring over the next couple of years.
The exodus of older, experienced nurses creates higher demand for new ones. But nationwide, the number of nursing students has also been falling since early in the pandemic. It was down more than 15% last year, hitting a 10-year low. To help those who are enrolled, the Cizik School has added tutoring programs to help students graduate, and it's doubled scholarships to entice others in.
We still have a long way to go until we reach our goal of making undergraduate education free, but it's a step in the right direction.
The state has taken its own steps too, from loan forgiveness to funding research projects done by young nurses. At the same time, there's a shortage of nursing faculty, which forced schools here to turn away more than 10,000 qualified applicants last year. This too is a nationwide trend.
In order to be nurse faculty, you still have to be a nurse, and then you have to go and get additional doctoral training, which is about 1% of nurses, so it's a very small pool of people.
There's no short-term fix, especially when the overall shortage is driving up salaries for nurses with advanced degrees who make more at the bedside than in the classroom. Those who do teach say the next generation of nurses can already see its own value.
These kids, they're the future. And they're just going to do it their way. The old ways don't work for them.
Elda Ramirez is not just a professor here, but an emergency room nurse in 2 county hospitals.
I'm happy because finally there's this new generation of people that are going to go, I'm not going to tolerate that. They're going to say, no, you're not going to pay me that much money. No, I'm not going to tolerate those hours. No, I'm not going to only work night shift. They're saying, no, if you need me that bad, let's talk. That's what we need.
Hi, Jay. You there in the virtual?
In the meantime, we can expect to see more hospitals like Houston Methodist trying to do more with less.
So you see here that she's able to provide this care for 16 patients at one time.
All right, and then it looks like you already have an active MyChart account.
If that technology helps nurses stay in the profession, all the better.
It sounds like this shift means you got to stay in a career that you loved but was taxing for your life.
I have told a lot of my colleagues, like, this is probably the best sort of job I could even dream up for a nurse. I'm still using my knowledge and skills while also kind of, balancing my home life and making sure I'm mentally present and okay.
A balance that has been hard to find since a virus threw our healthcare world off kilter. For the PBS NewsHour, I'm William Brangham in Houston, Texas.